welcome. My name is Katy Grainger. 7 years ago today, I was visiting my two daughters in California. I lived in Hawaii at the time. And we were in San Diego with one daughter who had just started a new job, having graduated college. And we met her sister who was studying in Los Angeles and went to Disneyland. And this was about 5 days, I think, before I found a small infection on my thumb that led to my sepsis journey. I had landed on an airplane on the island of Kauai, the small island that my husband and I were living on as empty nesters, and he was away on a fishing trip. I went to a clinic because it was oozing and looked weird, and I'm just gonna call that a gut instinct, that just something wasn't right about it. And at that clinic, these were the last medical people I saw before I nearly died in my bed. So I just want to stress that pre-sepsis, obviously the prevention, but also that experience that a person has. I don't know what the statistic is off the top of my head, so I'm not going to throw it out there, but I know that a majority of patients actually visit a clinic and are turned away because they don't have sepsis, and I did not have sepsis. I had a small infection, and I just had the possibility that it might get worse. But what did not happen at that time is I wasn't really told about how serious a little infection like that could become. And it's part of what's missing in this whole thing that we're working on today is informing patients a little bit about their bodies, that an infection can cause death. An infection can cause amputations, which I have. I have lost both my legs and I've lost my fingertips. I nearly lost my hands. It's a miracle that I have them today. It's a miracle that I'm alive. And I have a lot of you to thank. I know that some of the people undoubtedly in this room helped save my life, so I thank you for that. I survived septic shock, but it changed my life forever. I stand before you today on my fancy high heels that you just saw and my prosthetic legs, a different woman than I was 7 years ago. Today I'm a sepsis survivor, I'm a multiple amputee, and I'm a proud member of the Board of Directors of Sepsis Alliance. And with that position, I've had the opportunity to use my voice to influence people like yourselves, or to encourage you to work harder and to educate the public about awareness about sepsis. I have been able to speak to some of your companies, and I want to let you know that I am available to speak to other companies and to the same companies over and over. I cannot get the message out enough about the importance of saving lives from sepsis and helping reduce harm. And that's why I do serve on the board of this organization, who has that same vision for a future where people are not harmed and are not killed by sepsis. Every one of you in this room, with your talents and resources, has the power to change that. We know that prevention, early recognition and diagnosis, and prompt treatment saves lives. We know that awareness campaigns work. And we know that when health systems and industry align around a cause, transformation happens. Look at the progress made in what Carl was talking about with cancer and HIV and those dollars that went toward it. Sepsis deserves that same level of coordinated effort, government support, and investment. This is where we all come in this room. Sepsis Alliance Symposium is uniting the patient voice with science, medicine, and innovation. We're not just raising awareness, we're driving change in how sepsis is prevented, how it's recognized at home by patients, how it's diagnosed, and how it's treated. When I left that clinic, I did not know the signs and symptoms of sepsis. I knew that I needed to watch for an infection to get worse and for it to become what I'm going to call systemic. That was my basic understanding. I actually knew someone who lost a limb to sepsis, so I knew that there was a big consequence of it, but I had no idea what the symptoms were. Like most Americans, I believed that I needed to have a fever in order to be sick. And so I sat at home all weekend taking my temperature, and I ignored every symptom of sepsis that occurred that first day that I was home alone. In order to succeed, we need to improve sepsis care and survival, and we need more than just our passion. We need to use our resources, we need to use partnerships, and we need companies to step up financially and with human capital to make sepsis a priority, so that patients will understand what it is and so that it can be treated. Lives will be saved, limbs will be saved, and families will be spared. When I was fighting for my life, it wasn't just medicine that saved me. It was a collaboration between the providers, myself to a limited degree, I will admit, because my family was really who was representing me, and my community. I went into the hospital and I was already suffering from severe mental decline. So I had a friend that acted as my advocate. She grabbed my ID, she grabbed my insurance card, she made sure that she had my phone so that she could call my family. And she was prepared when she took me into the clinic, and I was acting like everything was fine, even though moments before I had been crying in her car saying my hands and feet were on fire. She told the doctors, don't believe her, she's just a people pleaser. She just wants you to be okay. She wants to be okay. She's not okay. And they took it seriously. They had a sepsis protocol, and they immediately did all the things that they needed to do to get immediate antibiotics in my body and fluids, to raise my blood pressure, which was 50/30. And my friend sat by my side and advocated for me when I couldn't advocate for myself. She got in touch with my family, and they all insisted that as soon as possible, they really wanted me to get to the Level 1 Trauma Center on Oahu. I was eventually airlifted, and I did require it. My kidneys had failed, and they couldn't treat me in that location. And then when I was in the ICU, my family put up photos because they saw this weak woman in a bed. And they said, that's not my mom. I don't want these people to look at her as this sick person that they see. So they ran and got pictures blown up of the graduation I had just attended for my daughter and of our trip in Disneyland. And they showed, this is the vital woman that we were with a week ago, to give the medical team an idea of who I could become again. And everybody worked together to make my experience as comfortable as possible. When I was trying to save my hands and feet, my family let me and my medical team, they never mentioned the word amputation. It was not said in my presence until I first said the word, which I think was possibly the day I was having my amputations. That word was not used, we simply talked about surgery. They did what they could to protect me as a patient because they cared about what was happening with me. And they did everything that they could to save my life. Ultimately, it was a collaboration between science and humanity. That spirit of collaboration is what this symposium is about. And all our collaboration must be matched by commitment. We need you to take what you learn here back to your organizations and make sepsis a line item in your budgets and a priority in your strategic plans. Not for now, it has to happen now because it can't wait. We keep pushing it ahead. We keep pushing it off till next year. That needs to stop. Sepsis needs to be in our budgets and it needs to be a priority. And the fact that you're all here today says to me that it is for you, and I can't tell you how much I appreciate that. I stand here as living proof that survival from septic shock is possible. And I'm well aware of the fact that had I got sepsis even 5 years earlier, I would not have survived. My odds when added together were 1,000% chance of me not surviving when you added every organ that was failing and everything that was, every complication that I had. It's also a reminder though of the cost of delays. None of us can do this alone, but together we can transform sepsis care. We could give more families back their loved ones who will survive sepsis. We can make sepsis impossible to ignore. Let's unite this week and into the future, not just for sepsis, but for every life depending on us. Thank you so much.